African Institute of Public Health. And you saw me in suit, well dressed.
Nice
That's how fellows are dressed. So before I give this topic, I want us to encourage us that wherever we find ourselves, whether in the bush, whether in the town, whatever we are doing, just keep on doing it. People around you may not recognize you, but heaven is watching. People around the world, they are watching. Don't be discouraged when we are putting in your best and what you are getting out is nothing. Be resilient. You were at that meeting at that mental health. Yes. Just keep on doing it. Keep on doing it. A day will come. A day of reckoning will come that your record will be open. And what is due to you, even beyond where you are walking, will be given to you. Yes. Let him that hear what the Spirit is saying. Okay, so we are celebrating World Diabetes Day, and this is my 11th month here, and I can confidently tell us we have staff members, we have staff relations who are diabetic. Some with complications. So this topic today is very, very important for us to educate ourselves how to prevent diabetes mellitus. So as a way of introduction, what is diabetes? In my mother tongue, Yoruba, they call it ito sugar. What do they call it in Kwale? Please function me. 100 naira. Mr. Khalifa, what do you call it in your language? You are not local. You are not local. You are Oyibo people. Ha. Okay. Oh. So diabetes means there is an abnormal high amount of sugar in your blood that is so injurious to the body. As you are standing here this morning, there is a normal blood sugar level that should be found in your blood system. When you eat akpu, when you eat banana, you eat santana, you eat eba, you eat gari. When those things digest in your system through your GIT, it enters the blood. There is an hormone that God has put in your body called pancreas. It is that pancreas that secretes an insulin, an hormone called insulin. That insulin is what is used to control the sugar level in your blood. So, as you are standing now, there is pancreas in each and every one of us. But for those who are diabetic, it's either the pancreatic cells are not working again, so that insulin cannot be produced into the system when you eat all the food in this world, or either you still have pancreatic cells in your system, in your body, but they are not working very well. By the time you eat, get digested, enters your blood, there is a signal that tells pancreas, oh yeah, secrete insulin to mop up the sugar back to the muscles. But when you eat santana, you eat eba, amala, yam, pounded yam, and it gets digested, and there is no insulin, the sugar will just stay in the blood. It will be building up, building up, building up. We call it hyperglycemia. And it can kill. Just like hypoglycemia, when the sugar level in the blood is very, very low, that one too can kill, because your brain cells needs glucose to function. Sometimes when you are hungry and you are walking, you cannot coordinate again. No be so. When you are hungry, you want to say A, you say B. You want to see Mama Titi, you see Mama Shola, engineer. No be so. You cannot coordinate because your brain are not working, because there is less sugar for the brain to function. So just as we have hypoglycemia, that is very low sugar level, below the normal, we also have what we call hyperglycemia, when the sugar level don't enter the roof. It should not be our portion.
Amen.
The two can kill. The two has been killing from immemorial. So, that is the introduction. So how does people that have diabetes, how do they present? We call it, the three classical symptoms, we call it 3 Ps. 3 Ps. Number 1, polyuria. Number 2, polydipsia. Number 3, polyphagia. Don't worry. Don't worry. I will break it down, Mr. Albert. I will break it down for us. Please do, I will break it down. When we mean that polyuria means you are urinating too much. Before the night breaks, you have gone to toilet 10 times. I know some people here, they drink. They know themselves. You know, when we drink, there is always a way the kidney try to passes you to make a lot of urine. I'm not talking of that one, no. Before night break, you go to toilet. Everybody, they sleep for house. Not only you, they go up and down, up and down, up and down. It's not normal. So anybody who is experiencing that must come to clinic for checkup. Polyphagia. You are just eating. You clear Santana. You clear Gary, you clear rice. But you know they show for your body. As you they chop, you know they show for your body. Voila, you know they show. The person is getting leaner and leaner and leaner, but he is eating. Number 3, polydipsia. You can finish 1 bag of pure water. You know 1 bag of pure water? Just be drinking like horse. Just been drinking. As you drink, you piss up. As you drink, you piss up. Excessive thirst. You are always thirsty. It is not normal. Number 4, if that person has a wound in the body, or maybe in the leg, you no go heal. So if you know somebody who get wound for leg or anywhere in the body, you don't drink vitamin C, you don't take antibiotics. As long as the sugar level is high in the blood, that wound cannot heal, except the sugar level is controlled. What do you mean? Number 5, you men, what you like doing at night, you know it. Engineer is looking at me. You know what you do now? You like drink water. I say drinking water. Not be water. What you like doing at night? Anybody who is diabetic, the thing not gonna stand though.
Active.
Serious. That's the truth. The wife will be complaining. Baba Sikira, kí ló ń ṣẹlẹ̀? Baba Toyin, ṣe báyìí tẹ́tẹ́lẹ̀. What is the problem now? And you see men, we men, if you cannot perform, now wahala. Your morale, not be so. Sorrow now.
Not so.
Yes, that's how God made man. That's why I'm being raw today. Ask those who are diabetic, they will tell you they don't have erection. Some are shy. When they come to me, doctor, I have a problem. I tell them, I know where you are going. They say, how do I? I say, I've been in this trade for long now. I've been in this market for long. They say, my team know they strong well. My madam, they complain too much. I say, okay. Have you been coming for clinic for checkup? No. You do blood sugar level, 400 plus. How do you want to have erection? The sugar they affect now, so I'm still coming there. Sometimes indigestion, you eat, you no go digest. For women, they have what we call multiple boils around the private area.
Yeah.
Boils. You see them having infection, discharge around the private area. You don't use all the antibiotics. You don't use canesten. You don't use all these vaginal tablets. But still, you are still having discharge. It might be that your sugar level is high and is breeding infection. So when you notice all those things, it's not good to just stay alone. Run to the clinic. Doctor will clerk you, ask about your history. You tell them, oh, are the pills too much? Oh, how many times? Oh, okay. Once you are able to take 2 or 3 out of those things, you know that what you are dealing with is likely to be diabetic mellitus. And before I go on, there are 2 types of diabetes. How about I have time? We have type 1 and type 2. Type 1, they affect small children. Anybody less than, from, let's say, less than 40 down has type 1. But most people have what we call type 2 diabetes mellitus. The type 1, they call it insulin dependent. Because in that type 1 for children, that insulin don't damage completely. The pancreatic cells is damaged, cannot secrete insulin again. So what will make those children who has type 1 to survive is that you have to be giving them artificial insulin, like injection. They will teach their parents how to be injecting them. Those ones they are injecting are the ones they get from horse, from cow. Horse too has insulin. So Oyibo has done it that we can use the horse one for human being, it will still work. They've mixed the chemicals together. Are you getting me? So type 1 is dependent on insulin. They have to get insulin till they die. They can't live without insulin injection. That's too bad. But for type 2 that most people have, we have drugs that can boost. Maybe the insulin is getting weaker. The pancreatic cells is getting weaker and weaker. We have drugs that will stimulate it to produce more. Are you getting me now? The 3rd type of diabetes we have is what we call gestational diabetes. That one happens to women when they get belly. There are some women that when they get belly like this, their sugar will just rise up. We call it gestational diabetes. So when somebody has all these things, or maybe you can just come, some don't even have the symptoms much, but once you come to the clinic and they say, want to do test, they take your blood, let's do random blood sugar. We do random blood sugar, we do fasting blood sugar. These are the common ones we do. We do urinalysis. That one is simple. But the fasting blood sugar is the most one we use for the diagnosis. Once your fasting blood sugar, maybe the last food you ate is in the night and you never eat till this morning, and they check your blood now. For those who have not taken maybe tea this morning, your last meal is just maybe 9 p.m. last night. And we take, if I take a sample of our blood now, using a glucometer, that is fasting blood sugar. We take it between 7 and 839, maximum 9. Any value, if I get any value above 110, that person is at the range of diabetes. If I get value of 200 now, you never chop this morning, you are diabetic. And most people don't even know that they are diabetic. But the good thing is, if you don't take care of diabetes, it's a metabolic problem. It affects virtually all the systems in the body. Let me talk about the complications from the head. It affects stroke, can cause stroke. People with diabetes, we call it diabetic retinopathy. It affects the eyes. They can't see very well. They have blurring of eyes. If they open book, they can't read because the sugar is being deposited in the optic disc of the eye. Coming to the heart, diabetes is also a problem with heart diseases. Are you getting me? Coming to the kidney, it can cause chronic renal failure. We call it diabetic nephropathy. So diabetic is not a good sickness at all. But the thing is, anybody that has it needs this education on how to manage it. What are the management techniques? Number one, drugs. There are drugs that we use. If you are type 1, you must be on insulin injection for life. If you are type 2, there are drugs you need to be taking, like metformin. They know, those who are taking it, I won't mention name, they know what they take, what we give them. Metformin, Dawodu. They help to stimulate the pancreas to secrete insulin into the blood. Exercise is needed for diabetic to help to maintain the glucose level in the blood. If you are diabetic, mind what you eat. All these, what do you call it? All these sugary drinks, all these sodas, Coke, Fanta, Maltina, is not good for you. Diabetics must take leafy vegetable. The more of vegetables should be their food. When we were in the medical school, over 20-something years ago, the teaching was you should be eating unripe plantain, eating beans. Can you eat beans in the morning, beans in the afternoon, beans in the night, tomorrow morning beans? What will happen? Tell me one thing that you will do. You will be messing. You the office of engineer. Somebody don't mess here. No be so. So that was what they taught us. Eat beans, unripe plantain. But the teaching has changed now that diabetic can eat all the food that we eat. They can eat bread, they can eat yam, they can eat anything, but the quantity must be small. If before you are diabetic, you eat 4 wraps of Santana. What is Santana?
Apple.
You have been eating 4 wraps. Now that you are diabetic, the person is diabetic. No, not you. Now that the person is diabetic, you know the kind of food that a 3-year-old will eat, the quantity is what you'll be eating. If you want to eat bread, 2 slices of bread. If you want to eat yam, 1 slice of yam with plenty vegetables. The days of eating mountain for diabetes is over. We encourage them to eat more leafy vegetables. They should be coming to clinic to checking their blood sugar level. They can also be doing it at home. They need to buy glucometer. Just as those that have hypertension, to buy sphygmanometer. For those who are diabetic, we always tell them to buy glucometer and be checking their blood sugar level. We'll ask them to write it on a paper or exercise book, to record it every day. So that by the time you come to clinic, we will know that yes, we are winning the war. Before, we normally do either 3-point glucose check or 6-point glucose check. Like now, diabetic, this morning they will have done it. Before lunch, they do it. After dinner, they check it. So that when you come to the clinic, the doctor will say, okay, let me have a glance of your glucose control. Oh, we are winning the war. It can maintain the drug or add more based on the evidence, because it is evidence-based. Are you getting me? So, complications arises. Let me draw the curtain. Something happened here few months ago. One of our staff, I won't mention name, but happens to be a brother to one of our senior management staff. He knows he has this condition. He doesn't come to clinic. He doesn't come for checkup. But they noticed that he was talking anyhow. As I told you, His speech not coherent. And the nurses said, even like say this man is about to have diabetic ketoacidosis, a complication. It's already entering into his brain. So, in brother, Rush came here. By the time we checked the sugar level, 460 something. If that man has still remained in his house, he can even die. What are we talking about? His evidence is around us. For those who have it, there is need for them to take it serious. People have been having diabetes, have been living with it. Just follow the instruction. Don't eat what you want not to eat. You go to a party, you are diabetic. They bring fufu, you chop. They bring amala, you chop. They bring montana, you eat. You eat everything. Say, this is an opportunity for me to chop. Are you not killing yourself?
Thank you, sir.
Thank you. So if you have questions, one or two.
Please, a round of applause for our